All right. Hi, friends. So I am Nicole Weir. I used to attend at UW-Whitewater and I got my associate's degree at METC for early childhood education. I recently went back to school to try to be a psychiatrist at UW-Madison, and I recently got a job at a mental health institute being a psychiatric care technician. And so what I'm going to talk about today is trauma-informed care. I gave this presentation at UW-Whitewater about 2 years ago. So this is my first video recording presentation. So let's get started. First, we're going to try to define what trauma is. This can be a very subjective term, so everyone kind of goes through trauma differently. And here's a definition that I found that I think really puts it in perspective. Trauma is a psychological distressing event that is outside the range of normal childhood experience and involves a sense of intense fear, terror, and helplessness. So some things that are commonly considered traumatic include different kinds of abuses. So this can be physical abuse. This can also be things that were witnessed by the child, so not necessarily experienced by them, but as say their parents have been physically abused in front of them, that can be considered a traumatic experience. Other kinds of abuses, sexual abuse, emotional abuse, neglect can also be one. I'm not sure if that's probably in the rest of them. Untreated mental illness is also a big deal. I think this one goes unnoticed pretty often just because you don't always know when someone's going through a mental illness, and the more prolonged treatment is, the harder it is to recover from it. Neglect is another form of trauma. Loss of a primary caregiver. This doesn't necessarily have to be a parent. This could be a grandparent, aunt, uncle, whoever primarily takes care of the child. A natural disaster, any kind of tornado, floods, something that gets their home pretty much destroyed is traumatic. Homelessness, witnessing substance abuse, and incarceration of a household member. And foster care can also be very traumatic depending on the families that these children get placed into. The next thing that I like to go over are different facts about trauma. These are pretty eye-opening and help a lot with trauma-informed care because one of the main things about trauma-informed care is being informed about trauma. So knowing more facts about it is very helpful in how to treat. So 25% of American children have experienced some form of trauma. 25% of these victims develop PTSD, depression, or anxiety disorders. 56 of the population have reported they have experienced one or more traumatic event. That is the entire US population. 60% of adults report abuse, family difficulties during their childhood. And this one is really eye-opening, I think. I work at a mental institute where they have forensic patients, and so far, vast majority of them have had some kind of abuse during their childhood. And so this statistic is 92% of incarcerated females reported abuse during childhood. And people who have experienced trauma are more likely to attempt suicide, become an alcoholic, and or inject drugs. One important thing I like to note about these facts is I don't want to scare anyone into thinking that there's nothing that can be done about them to reverse some of these statistics. Trauma and abuse will continue to happen. It's the people involved after the fact trying to help the individual that can really alter their rest of their future. Another thing that I like to note during trauma facts is the ACEs study. I'm sure all of you have heard about the ACEs study at least once during your early childhood experiences. So I won't go too in depth of it, but I'll also talk about ACEs again later. But that's also a very eye-opening study on how much abuse and trauma are out there. All right, the next thing to dive into are specific Wisconsin statistics. I kept the 2017 statistics on here. Eventually, I'll update it. I want to update it for the 2020 statistics because I think with COVID, this might be drastically different. So right now I'm going to stick with 2017. Some things to note is the terminology here. Substantiated means that there's proof found. Unsubstantiated means there wasn't proof found, and such. This is again to try to get you thinking about how the prevalence of trauma and abuse are relevant to Wisconsin specifically. One thing that I really like to note here is that the male to female ratio of victims is close to 50-50. I feel like a lot of people assume that females are generally more targeted in terms of like sexual abuse. They're generally more targeted with emotional abuse, while many people believe that males are more physical abuse and neglect, whereas it's really 50-50 on both counts. This is also an important statistic to look at. This is the profile of the maltreaters. And as you can see, male and female, there's no strong argument for either side. It's pretty 50-50. A lot of people assume that more males are the ones abusing children in some sort of way, but it turns out it could go either way. The age range is something I also think is important to look at. Under 20, there's only about 156, but the main people that are abusing children are between the ages of 20 to 39. This helps you kind of understand when you are suspecting some kind of abuse from a child, given the age range of their parents or age range of people that they have in their life. This might help pinpoint. This graph here, or this table, talks about the reporters. So these are the people that have been reporting the abuse about the alleged child victim. And I circled the child care provider because there's only about 1% of us referring anything. And I think it's really important that we are taking this seriously and reporting. We're mandatory reporters, so I won't harp too much on it because I know we all have to go through that training as well. But I do think it's important that if we suspect something, we say something. This slide I recently added in. I think it's really important that we know the actual CPS phone numbers. During mandated reporting classes, I feel like they kind of graze over this part. And I think there's a lot of misconceptions around the process of CPS. Many people believe that Child Protective Services, the first thing they're going to do is just shake the child away immediately, and that's going to be the end of it. But one of the things that they try really hard is to ensure the child's safety. Like that is their ultimate goal. That is what they would like. And they do so if they can keep the child in their home. That is the goal. They want to educate the parents if that's what they need to do. They don't just want to come in, see the abuse, and take the child away right away. That's kind of the last step. And usually after a thorough investigation, often they refer parents to appropriate resources to better assist them in caring for their children. They also provide services for adults in abusive relationships. So if the parents are also experiencing abuse, their goal is to provide resources for them as well. I also would like to have a quick tidbit on suggesting keeping a binder filled with local resources near you. I created one a while ago, and it's just a black binder that says community resources on it, and there's tabs for different things that people might be going through. I have AA meetings in there, different substance abuse resources, different childcare, like the in Madison they have the in Madison, we have different centers that provide care for children when their parents cannot for free. So including things like that, also including different mental illnesses that may present themselves in childhood might also be helpful in case a parent doesn't really know what's going on with their child, but they don't really want to ask. So this binder is just kind of there. Anyone can access it at any time. yeah, anonymously. That way they can find the help that they need and do so without feeling pressured or feeling scared. Moving on to how to kind of identify trauma in children. Every child experiences and expresses these signs differently, so there is no one combination of these tendencies that can 100% pinpoint abuse. One thing that I also would like to note here is that I said earlier, trauma is very subjective, so experience that a child may have might be extremely traumatic for them where it's not really a big deal for others, and vice versa, something that could look very traumatic might not really affect a child at all. So some things to look for in their behavior include fear. This isn't like general fear. This has turned into some kind of extreme fear. Like when you go to like pat them on the back for whatever reason, they flinch or tense very noticeably. Anger, this would be sudden outbursts of things that they probably were never really angry about before. Withdrawal, this can be from other people. It can be from activities that they used to like to do. They tend to have concentration difficulties, so if you're starting to notice them struggling during activity times, then kind of looking off into different directions or getting frustrated with themselves that they can't focus on something. Difficulty with relationships, either with peers or adults. Digestive troubles include a child who may complain about a chronic stomach ache with no obvious cause. It could also be a child that goes to the doctor regularly for digestive troubles and they haven't diagnosed them with anything. Nightmares, you can generally get a sense of if a child is having nightmares from the parents. Avoidance and withdrawal kind of go hand in hand. And again, trauma is expressed differently in every child. Here are some risk factors for trauma. These are just things that sometimes lead to more traumatic experience. They're not necessarily, trauma doesn't really discriminate. Trauma experience happens to everyone. These things just kind of have an increased risk for experiencing traumatic events. So a child with mental or physical disabilities, they may be picked on. Their parents or caregivers may make fun of them for these. Isolation, so if a child doesn't have any friends or isn't allowed to go see any friends. Parents' lack of understanding child behavior, needs, and development. This can really affect the child's ability to do a lot of things as well as be abused in some sort of way. Parental history of substance abuse and or domestic abuse, poverty and unemployment, parental stress, and community violence. Moving into the effects of trauma, I like to start with the long-lasting effects because a lot of people can see the short-term effects of trauma, but it's really interesting how impactful traumatic events can be for a human. So this book that's right here is The Body Keeps the Score, and it goes through the author lists all of these clients that he's had and how their traumatic experiences as children has affected their entire life after the fact. So some things that can start to develop is mental illnesses, including PTSD, often depression, anxiety, lots of increased incarceration, substance abuse. Physically, they can also go through a lot of baggage in their body from the trauma. In The Body Keeps the Score, Brain, Mind, and Body, and the Healing of Trauma, there are many people who experience traumatic events tend to have more chronic pains. They have more chronic illnesses related to the more medical side of things. And another thing to note here, the brain development of children who have experienced trauma. The brain alters, there's higher level of cortisol, which is the stress hormone, and there's difficulty in executive functioning. There's lack of coping mechanisms. They tend to have larger amygdalas due to overuse. Amygdalas are the fear cortex of our brain, so they're actively going constantly, so the fight or flight is usually always activated. They tend to develop smaller hippocampuses, which is where memories are stored, so they have difficulty remembering things. A lot of times traumatic memory also is more disorganized, fragmented, and they cannot recall the sequence of events, or they're missing details. So this is when a child is actively trying to remember what had happened to them later in life. They often can't tell a story beginning, middle, and end of the abuse. There's usually just little tidbits of things that they remember. Continuing on to the developmental effects of trauma, we already touched on the brain development, their cognitive development. Again, they have impaired memory and they usually have trouble learning new things. Social emotional development, they struggle with relationships, they struggle understanding emotions. They also experience survivor behaviors. These often look as defiant or manipulative. They're often seen as aggressive and hard to reach, meaning they're very guarded and dismissive of support in regards to their trauma. And again, their physical health and well-being are very attacked during this stage's development as well. So trauma impacts every single part of development. This slide includes a long list of different screening tools that we as child care providers have the opportunity to use in most facilities. None of them are really exact trauma screening tool. So you can use a number of these to try to assess if a child may be experiencing a traumatic event. Another option or resource that you have is to give the ACEs questionnaire to a parent. They can score it themselves and provide you with just a score number instead of going with it individually, one by one. They don't have to tell you everything that the child has experienced if they don't really feel comfortable expressing that information. Otherwise, a number of these tools, if you see red flags in them, could be an indicator of trauma or abuse in the child. So now let's dive into what exactly is trauma-informed care. These principles are generally geared towards trauma professionals such as therapists and counselors, but these practices can easily be adapted for child care professionals, and it will only benefit the child and the teacher's professional development. So trauma-informed care is aimed to develop or recreate a child's feeling of safety. It's a very big, important thing. If a child can feel safe, the child can talk about the trauma, the child can understand the trauma, and the child can move on from the trauma. And these strategies help to connect a child's traumatic experience with themselves and others. A lot of times children don't even understand that what they went through is traumatic. Sometimes they don't think it was wrong if it was some kind of abuse. So these kind of help the child to understand what happened to them was wrong in a non-judgmental way and how it connects back to themselves and others. Trauma-informed care has been based on research by over 30 trauma specialists while considering previous and current theories about trauma intervention. And these developers of these practices have also taken into consideration research conducted in fields of neuroscience, psychology, and medicine to influence trauma interventions. So they look at all kinds of aspects of the medical field, psychology, neuroscience, and they put it all together so you can better help a child go through this. So the 4 R's of trauma-informed care. Realizing, so in this stage, you're realizing the prevalence of trauma, either in your state, the country, however you want to look at it. Recognizing how trauma affects all individuals involved So this is when you notice trauma in a child and you started to recognize how that affects their life, how it's impacting their relationships, how it's impacting their performance if they're old enough to be academic uh, responding. So this is by, oh, sorry. There's a car alarm going off, but it stopped, so let's continue. Responding is putting the knowledge that you've gained from realizing and recognizing and putting it into practice. And resisting re-traumatization, this is your attempt to figure out what kind of traumatic experience the child has gone through and to do your best to not re-expose them to that same kind of trauma. This is also for staff as well. If you have ever been traumatized for whatever reason or had a traumatic experience, this is also kind of protection for you to make sure that you're also not putting yourself in a position to be re-traumatized as well. Some really great intervention practices. Here's a quote that I think is really important because you can go through all these intervention practices, but this really means nothing if the child doesn't feel safe with you. So there is no more effective neurobiological intervention than a safe relationship. So things that you can do to help the child after you've established a safe relationship is to teach breathing skills, stretching, and movement, promote positive self-talk within the child. So you can teach them yoga, you can have cards in your classroom to help them do that, have some structured sensory interventions, express self-regulating interventions, safety, try to protect the child, model empathy, trauma-informed relationships. So now you have a baseline of what trauma is and how you can deal with it, and then just try to connect with the child, respect the child by providing choices and redirects. So connect the student with peers or supporting adults that can show them various coping mechanisms and help them feel like they're not alone. Another important thing that I like to mention here is creating a safety plan with the child. So have like a list of questions to ask the child to make them feel more comfortable. Approach it lightly as well. Kind of approach them and say, hey, I'm curious, where in this building do you feel the most comfortable and safest? With whom do you feel the safest? Of all your classes, in what class do you feel the safest? Of all the activities you take part in during the week, what is your favorite? You can also ask when something or someone really upsets you, what or who calms you the most. And this really helps you understand what makes the child feel safe. It helps make them feel heard and seen, and then be able to create this plan for them. So if something re-triggers that trauma, they have that place that they feel comfortable, they can go, they have that person that they can bring with them in some way. Make a plan around it. Sounds like a lot of work, but it will impact the child for the rest of their life if they can have this one safe spot in their class. Make sure that you have 10-to-1 positive comments to negative comments. This could go for every child, whether they've had trauma or not. Praise is much more effective than punishment. Constantly tell people what they're doing right, and that way they accept the feedback a little bit better when there's only one negative comment to every 10 positive comments. And focus on the relationship with that child to reduce the chance of isolation. Moving on to the strategies to adapt for in the classroom environment. Routine. A lot of this list is things that you're probably already doing or have already learned that help all children. These are just especially more important for children who have undergone trauma. Choices, always provide choices. A nurturing environment, communication with the child, foreshadowing change, simplicity, core values and beliefs, appropriate training. So if you feel like you need more trauma-informed care, go seek it out. Allow the children to express what makes them feel safe or unsafe in the classroom. Take that feedback if something is making them feel unsafe, or if they're expressing some kind of anger towards something that's in the classroom. Don't be afraid to change it or remove it from the situation altogether. Allow children to bring comfort items into the classroom and or activities. When I was a child growing up, I had a stuffed animal Kipper, and I did not go anywhere without him. So a lot of children who have gone through trauma, that stuffed animal or comfort item helps them express themselves because they feel like they're safer with that item. And provide options for self-regulations. Other things that you can do to help around in the classroom is add some music to the back room. You could do some piano music that helps to soothe and calm. You can put up pleasant pictures that can help the children, help calm the children, like puppies or nature, or really anything that interests these children. If you can find a picture, just hang it up, and sometimes they might just stare at it. Create a reward system instead of a punishment system. That way they have something that they're striving for constantly, and you can remind them about the reward system, and try not to do a reward system that takes away things if a child is lashing out in the classroom as much. Try to just reward positive behavior over punishing negative behavior. Moving on to strategies for your self-care, because you and your mental health are just as important as a child. Some things to remember is that you may never see the fruits of your labor because change takes a long, long time to occur, but know that what you did was enough to create a foundation of safety for the child for the rest of their life. Remember to keep trying. It can be very frustrating when you try different strategies and nothing seems to be working. A lot of these strategies don't work for every child, so what might work for one won't work for the other. So you just have to keep adapting and keep trying new things. And then as far as your own self-care, be open to professional counseling, have some hobbies, do some exercising, have some tea, read a book, have your favorite food if you're feeling extra stressed. It's also very important to have some kind of time each day where you don't focus on anything about work. I know with teaching, a lot of times you have to bring a lot of that home because you have to do the portfolios for the children, you have to do evaluations, you have to grade paper, you have to plan for the rest of the days. You have to do a lot of things that sometimes you can't finish within your workday, so you bring it home. But make sure that each day, at least an hour, you're only focusing on you or your loved ones. It's very, very important to just have that time. Where I work now, I work with a lot of people with schizophrenia. I work with a lot of people who have gone through all kinds of trauma. And so sometimes what I see at work can be very stressful, and it kind of impacts my emotional state too. But what I try very hard to do is I sit in the parking lot at work before I leave, and I put on just some like piano music, and I just take some deep breaths, and then I go home. And home for me is home time. I don't bring anything home. I don't bring any thoughts of work home. I can tell people about my day, but once that's over, my focus is on relaxing things for me to do. I think that's a very helpful practice that helps you be prepared to continue trying for that child. This could be one of the hardest parts of your day because you can work children all day long, you can help them deal with their trauma, but strategies for working with the parents can be much more difficult and tricky to work around. And especially if you suspect one of the parents of abusing one of their children, that can also make it very hard for you to communicate positively with them. But it's important to remain sensitive to their situations, especially if you've known what happened or if you have an open communication with the parents and they've told you different aspects of the child's traumatic experiences. Make sure you are very non-judgmental about what that child went through. Be very open if the parents want to talk to you about this, because they likely don't really know who else to talk to, or they might not have the resources to really impact their own child's life. Have open communication with them, so be honest about their child's behavior, be honest of things you suspect with them. It's very helpful both ways. Be very consistent with them. It's very hard if you're very friendly with them when you first start to know them and start getting to know their child, and then if they ever express to you any traumatic experiences, you become cold to them. So make sure you're being consistent with your responses and your reactions to them. Again, honest and authenticity, that goes a long way with working with parents. It's important to note that parents will need a lot of support coping with what happened to their child, helping to educate them with your knowledge, educate them also about what happens next. Trauma often needs to be addressed multiple times. So if a child is sexually abused as a child, when they turn old enough to start getting into those kinds of relationships with peers, it's important to readdress that to make sure there aren't PTSD developing, to make sure that they can have safe and effective relationships as they get older. So be open to educating the parents that if they address the trauma now, along the line, they might have to keep readdressing the trauma, because as children get older, sometimes they start to remember things. They might not remember the counseling sessions that they had as a 4-year-old, but they'll remember things as they're older, and getting them back into counseling can be very helpful. Take the time to research local trauma supports. Long before you even experience a child who's had trauma. That way you're prepared and you can provide these resources for the parents right away. And also, if there's a local psychiatrist or counselor in your area, try to partner with them. You can reach out and say, hey, I don't have a lot of experience in this. Do you have any resources that you can provide me? They might often be able to give you handouts on more ways to communicate with parents or more ways to communicate with children. They can provide you with their information so you can provide that information for parents. So just be very open with the parents and other resources that are around you. I think it's important to touch on the COVID-19 pandemic. It can very easily be considered a natural disaster. So caregivers and parents who remain calm and reassuring during the pandemic decrease the likelihood of the pandemic being considered a traumatic event for children. However, being isolated, sometimes children might be isolated with their abusers. Not being able to see their friends kind of hinder their emotional and social development. So this can very, very easily be considered a traumatic event for the majority of the children that you are going to get back whenever you're back in person. If you're already back in person, you might have already seen some of these effects from a child that you had before the pandemic to now after, still kind of during. In one of my handouts, I included a really good article about the pandemic. So the handout that I'm providing is from the National Child Traumatic Stress Network, and it is about parent or caregiver guide to helping families cope with the pandemic, COVID-19 pandemic. It provides general information about COVID. There's a lot of things going on about COVID, so this is a nice little summary of things to help you be aware of. It provides ways for parents and families to endure it, helping reduce the risk. Very important basic information, how to cope with the information and the stress during the pandemic, different coping mechanisms, and then it goes through different age groups and how they may react to things. So for example, we'll go through the preschool one. So the age group is preschool. The reactions that they might be having include fear of being alone, bad dreams, speech difficulties, loss of bladder bowel control, bedwetting, change in appetite, increased temper tantrums, whining, or clinging behaviors. In different ways that the parents can help those behaviors is to show patience and tolerance, provide reassurance, verbal and physical, encourage expression through play, reenactment, storytelling, allow short-term changes in sleep arrangements, plan calming, comforting activities before bedtime, maintain regular family routines, and avoid media exposure. A lot of times parents don't really understand that what they're going through and how they're reacting to things impacts how the child will react to them. So for example, if a parent is very stressed, then the child becomes very stressed because they don't really understand what's going on either. And it's a lot harder to really verbalize the changes to a child because they don't understand what a virus is. They don't understand really any of it. But they respond very well to like needing to wear a mask and everything. So I think this is very important to go through yourself and to send out to families to also help them. The next few slides are various resources for the various parties involved in this kind. So there's parents, children, staff, etc. So starting with the parents, these are different resources that you can provide. There are much more. These are just some of the ones that I thought were more global and pretty important. So there are different websites, child welfare website, Child Mind, so this kind of shows how trauma impacts child's life and their responses. Hand in Hand is a really important article about how to overcome childhood trauma. And then I have a couple different books, and these would be like long chapter books for parents to read to help educate themselves on what their child may be going through. These are also helpful for parents in the long run as well to help understand the long-term effects that their child might be experiencing after the fact. Here are some resources for teachers. Again, these aren't specific to Wisconsin, these are more global. I have a webinar discussing parent involvement. So pretty much if you have any specific questions, you can also feel free to reach out to me and I'll try to answer your questions as best as I can. Doing your own research is also very important. I could help guide you along that path because I've done quite extensive research on this topic specifically. So this webinar that I have first is discussing the parent involvement. So if you need more resources on how to get the parent involved in caring for trauma, this is a good one. The National Child Traumatic Stress Network is just a huge website filled with all kinds of resources that answer all kinds of questions. A lot of what I found for this presentation was found on that website. And this is a little bit more detailed handbook with more specific strategies for a compassionate classroom. Very helpful for all ages. And then at the very end of this presentation, I have a long list of my resources and references. Feel free to click through those websites if you are interested in anything else. There are some children's books that go through expressions of trauma in a way that children can understand. So you can keep these books around for children any time of the year if you would like. That might help them feel more comfortable expressing things. If they see something in a book that kind of relates to them, they can maybe talk about their trauma. So do you have a secret? Let's talk about it. That's very aimed to help children feel comfortable to talk about traumas, because a lot of times if they're being abused, the abuser will tell them not to tell anyone, keep it a secret. And so the child doesn't really see that as a red flag. So this book kind of helps identify that keeping those kind of secrets aren't really that great, and will help allow children to feel comfortable talking about their traumas. They may bring the book to you and say, hey, this is happening to me. It can also help with conversations when a child is talking about their traumatic experience in front of peers. This can help the peers kind of understand, that trauma does exist. It's a very, very hard conversation to have, and it can be very scary for a child who's starting to express their traumatic experiences, and their peers around them are telling them how bad of a situation that is, because that can happen. And a lot of times children, they just don't understand what's going on. So an important thing to do is, if you hear a child expressing their traumatic experience, you can take them away from the group and talk to them one-on-one about it. But that still leaves lingering questions from some of the peers. And it's very tricky to come up with accurate responses to provide for these children. So giving them books kind of help understand different things. The last book with the mindful mantras, those are different ways to incorporate mindfulness into the classroom. She's got a whole line of books that include different things like I will be okay, more positive affirmations for children. I think this is really awesome to include in your classroom all of the time. I think it helps everyone build up their self-esteem, and just having mindfulness practices in the classroom is very, very beneficial for all kinds of development. Lastly, here's a short list of further training opportunities. There are all kinds of local training opportunities for trauma-informed care. You can go on a website and just Google search trauma-informed care classes near me. But here are some that I found that were just available for anyone. So Mind Up was a full research-based training program. They come to schools and give trainings to staff members. So if you're very interested in getting your facility more geared towards trauma-informed care, you could bring this up to your director. If you are a director, feel free to look them up and see if you like it. I have never used any of these. These were just ones that I found online, so I'm not trying to sell you any of them. Find anything that you think is accurate for your staff needs and go with it. There are also more local trainings available that you can easily find with a Google search. Here is my long list of websites that I found a lot of this information on. If you have any questions in one of my handouts, I will have my email. Feel free to email me any questions, anything you think that you think is important that I may have missed in terms of trauma-informed care. It's really helpful for me to hear those questions so I can adapt this presentation to meet the needs of all of you guys. It's very helpful reflection-wise as well. Thank you for listening to my longer presentation. If any of you were with me 2 years ago when I gave this presentation, it was a fast 26-minute presentation. So if you have any other feedback in terms of content, anything at all, please let me know. Thank you.